Hi everyone. Welcome to the Carson Kids Therapy Techniques series. Today we will be learning about sensory integration and Dunn's sensory processing. We will be talking about how sensory integration and Dunn's sensory processing are similar and different from one another. First, let's discuss sensory integration. Sensory integration is a theory and frame of reference that explains how we neurologically interpret the sensory information our bodies receive, whether it is auditory, visual, tactile, olfactory, gustatory, proprioceptive, or vestibular. It is our brain's ability to categorize the information from multiple senses within our environment to produce a response. Most simplistically, sensory integration is how our bodies integrate sensory pieces to make a whole picture of the world around us. Sensory integration is how our body processes the sensory information within our environment. Sensory integration develops in stages. Within the first year of life, our tactile, vestibular, and proprioceptive senses become integrated. These senses aid our ability to control our emotions and move our body against gravity. Next, the integration of our auditory and visual senses follow and serve as the foundation for speech and language development. The integration of our tactile, vestibular, proprioceptive, and visual systems are key to reading and writing. Sensory integration is how our body neurologically deciphers sensory information within the environment. It is how we can process information from multiple senses simultaneously. Sensory integration should be well developed by the time a child is 4 to 5 years old or entering grade school, as it lends to many school-ready skills that require the body to work as a whole. Sensory integration does have an associated treatment that is described further in our other videos. Sensory integration requires advanced certification. Dunn's model of sensory processing focuses more on clinical presentation and can be utilized by any trained therapist. Dunn's model breaks sensory processing into 4 patterns: low registration, sensation seeking, sensation avoiding, and sensation sensitive. Low registration refers to a child who requires more sensory input than others to produce a response. Sensation seeking refers to a child who never feels like they have enough sensory input. They are always craving and seeking for more. Sensation avoiding refers to a child who is bothered by their senses and attempts to escape or prevent them as much as possible. And sensation sensitive refers to a child who feels their senses much more than others. The 4 patterns Dunn's sensory processing are broken into are based on the interaction of neurological threshold and self-regulation. Neurological threshold refers to how much stimuli is required for one to notice and respond. Someone who has a low threshold may notice and respond to stimuli more frequently because their sensory system is more sensitive. Someone who has a high threshold often fails to notice stimuli because their sensory system requires strong stimuli to notice. On the other hand, self-regulation refers to a continuum that has passive on one end and active on the other. Someone who is on the passive end may feel uncomfortable or bothered by the stimuli around them, but remain in the area or the environment. Someone who is on the active end controls the amount of sensory input within their environment. like when you leave one room because it is too noisy and move to a quieter space. To quickly review, sensory integration is a theory and frame of reference that explains how our bodies interpret the sensory information our bodies experience and receive within our environment. Dunn's sensory processing describes clinical presentation, thresholds, and regulation. More simplistically, Dunn's describes the child, the what, while sensory integration focuses on the why and how to treat the sensory processing disorder based on our physiological understanding. Currently, therapists can utilize Dunn's sensory processing in treatment, but need additional certification to employ sensory integration. Thank you so much for watching. If you have questions or concerns, we would love to hear from you. As always, these videos are not a substitute for medical care. Please, always seek the advice of your medical team before implementing any of the strategies discussed here. Until next time.